Biomagnetic Therapy Training Course, Module 3. Chi Life Virtual University welcomes you to the third module of this exciting course of biomagnetic therapy. In this module, you will learn the general aspects of the biomagnetic pair. What is a biomagnetic pair? A biomagnetic pair is the distorted duality of biomagnetic charges which are generated within the organism due to a failure in the membrane and hydrogen potentials. It is composed of two sides of biomagnetic poles, disrupted by opposite polarity charges, but similar in their resonance. For example, A plus A, B plus B, X plus X, but never A plus B or A plus X. Biomagnetic pair examples. This example shows a frontal sinus pair. As you can see on the graphic, the negative side of the magnet is positioned on the right side of the body, and the positive side is on the left side of the body. This is the exact configuration we should always use: negative on the right, positive on the left. Unless the pain is more severe on the left side, then we will switch polarities and position the negative side on the left and the positive side on the right. I will explain this in more detail with more examples later on. This is a pituitary gland-bladder pair. As I explained before, in every biomagnetic pair, the negative pole of the magnet should always be positioned on the right side of the body, and the positive pole on the left side of the body. In cases like this one, where the biomagnetic pair is not mirrored, the position of the magnet poles is pre-established. This example for classic dengue uses the negative pole on the pituitary gland situated on the forehead and the positive pole on bladder. Right now you must be thinking, what is the relationship between classic dengue and this specific biomagnetic pair? I will explain this in more detail later on. Right now, all you need to know is that pituitary gland bladder is a biomagnetic pair related to classic dengue. When these two are unbalanced, there is a predisposition for this microorganism to develop. Biomagnetic pair diagnosis. The biomagnetic pair diagnosis is done through the REMI test, which consists on identifying the disrupted biomagnetic points or sources that are in resonance, thus forming the biomagnetic pair. These points are coerced by the genetic code engraved in every cell's DNA, which contains all the information from the conception date to the present moment. When the energetic levels are within normal limits, there won't be a measurable sign of imbalance. REMI test. The REMI evaluation test was developed by Dr. Remy Cadoret, 1928-2005, the precursor of energetic healing. It is done using a magnet, preferably its negative pole. This magnet is called a tracing magnet. We start by tracing the body, covering every biomagnetic point known to date, in search for a disorder. Once these disrupted points are identified, we proceed with the application of medium-intensity magnets on the traced biomagnetic points and leave them on for 15 to 20 minutes. Just like in acupuncture, the location of these points is entirely predefined and classified on a body map. A pair of magnets. The biomagnetic therapy requires a pair of magnets for each biomagnetic pair, and we use one positive and one negative pole. Right leg elongation. The elongation of the right leg is the response caused by the reaction between the magnetic field of the positive side of a magnet and the positive biomagnetic charge of an organ when the cellular membrane potential of the latter presents a disruption in which its pH level leans towards an acidic value. Biomagnetic therapy elements. The main element used for diagnosis is the biomagnetic pair. Healing is procured through selective biomagnetic depolarization and induction. This therapy is limited, though, by the irreversible state of the generation of an organ or organism which supports the neoplasm, malignant or benign, or the pathology. pH disruption. Through the use of magnets, we are able to modify the body's pH value to alkaline. Usually, when we place the negative side of a magnet on the body, the right leg contracts, which opens a window for alkalinity, in which bacteria and parasites can be eliminated, since they thrive in an alkaline environment, unlike fungi and viruses, which thrive in an acidic environment. Further explanation. This module covers the basics of biomagnetic therapy. The following modules will successively explain each concept at length, starting with module number 4, coming up next.